Welcome back to the NCTTRAC series. As part of the Texas Wristband tutorial series, this specific video will be focusing on guiding hospital providers through the two wristband structures, as well as their responsibility and their usage within the program. We'll first begin by going over the structure of each wristband, starting with the Texas EMS wristband. The single teal band provides a striking contrast from most bands used in the healthcare field. Within this close-up, you'll see the main portion of the band with both the barcode and the readable, unique alphanumeric characters. The clasping mechanism is also similar to other common bands utilized within medical facilities. These wristbands are designed for everyday usage, with emphasis on making them a standard part of patient care. The goal is to utilize this band on every patient every time, ensuring that their unique identifier is readily available. Moving on, we'll lead into the more detailed option, the EMS triage wristband. These wristbands have a specific use and structure to provide support for mass casualty incident events, or MCI events. As highlighted here, there are 25 wristband tags per bundle, with a terrible feature to remove each one. When applying to a patient, thread the end of the band through one of the loops found at the base of the barcodes, before removing the adhesive tab found on the end. Please remember, do not remove the adhesive until after it's been threaded through the loop. Additionally, an advanced feature of this band is the triage color tabs at the end. This capability will work with traditional and contemporary triage methodologies, such as SALT and START. EMS providers are encouraged to use the terrible tabs to provide a physical status marker on their patients. Further down on the band, you will find 3 additional barcodes that copy the main unique identifier on the inner band. This will allow for other healthcare providers to keep or share a physical copy of the information on the patient, such as giving a copy to other agencies or facilities, as well as attaching onto patient belongings, as shown here. Please note, if the EMS triage wristbands are unavailable on the scene of an MCI, the project encourages usage of the Texas EMS wristband as an alternative. Although the triage portion would be missing, the key component of the unique identifier would still be utilized. As with both bands, their structure and layout optimize the full aspect of the easy-to-record ID information. With the structure review now completed, we'll move into the program requirements highlighted for both the EMS and hospital providers. To ensure the success of the Texas EMS Wristband Project, certain requirements and operational guidelines are in place for all participating EMS agencies and hospitals. First and foremost, all participating organizations must be DSHS licensed and are expected to comply with the requirements set forth. Let's break it down. The initial process begins with the application of the wristband by pre-hospital providers. As such, hospitals will only receive the Texas EMS wristband for use, not the EMS triage wristband. However, hospital staff also play an essential role in ensuring that the wristbands continue to be utilized once entering the facility. A very important rule is for incoming patients. Hospitals are instructed not to cut off or remove the wristband from patients upon their arrival. It's vital to keep the wristband intact throughout the patient's stay at the hospital, and to continue utilizing the wristband ID number given to them. Hospital staff must also record the unique identifier in their electronic medical records, or EMR, specifically within a queryable field and not within a free text field found in the patient's chart. This step ensures that the wristband's identifier is integrated into the hospital's internal data management processes. It's also important that the wristband stays on the patient throughout any transfer. Only when the patient is discharged can the provider remove the wristband. This ensures continuity in patient identification and accountability throughout the entire process. Next, we'll go over some examples. Should a patient arrive at the hospital by EMS without a wristband, or if at any point the wristband is accidentally removed, the project requires hospital staff to reapply a new wristband from their own supply. Please ensure that the EMS providers are informed and provided the unique identifier for their records. If an inpatient is being transferred out to another facility and did not initially arrive by EMS, place a wristband on the patient for transport. Additionally, be sure the applied unique identifier is applied to the hospital EMR before they depart. The project also requires EMS agencies and hospitals to be enrolled in Pulsera, a digital communication tool, as this is essential for the MCI patient tracking component, as well as the Texas EMS triage wristbands. This platform facilitates real-time information exchange and collaboration during MCI events, improving communication and coordination among healthcare providers. As such, providers must be willing to utilize Pulsera during these MCI events. We also have some additional information to provide assistance. If a staff member ever needs to apply a wristband to a patient, please remember that the left hand is the most preferred option. Additionally, we encourage providers to utilize the barcode and QR code whenever possible for easier recording of the unique identifier. This prevents any potential errors when inputted manually. The same goes for soiled or illegible wristbands. If possible, hospital staff should replace these bands on the patients. However, instead of utilizing the new identifier number on the replaced wristband, instead, cover or cross out the new barcode and rewrite the original unique identifier on the band. The key is to continue the use of the initial identifier, so as not to misalign the already recorded information. Finally, let's provide a quick wrap-up of the previous content via the wristband two-step. As mentioned prior, there are essential elements hospital providers should follow to prevent any issues or occurrences with the patient. First, leave the wristband on the patient if one already exists. If not present, place a wristband on the patient prior to transfer. This will ensure that only one unique identifier is applied, and that the facility is added to the patient's current incident. Second, providers must remember to record the unique identifier into their EMR to allow for tracking of the patient information. By meeting these requirements and utilizing the Pulsera platform, EMS agencies and hospitals can maximize the benefit of the Texas EMS Wristband Project, enabling streamlined communication, accurate patient tracking, and efficient data management, fulfilling the goal of the project for patients within our service area. We hope this provided a comprehensive breakdown of day-to-day usage for the wristbands. As always, RAC staff is available should you have any questions over any of the components. We also encourage you to visit the NCTTRAC website, specifically the Texas EMS Wristband Project webpage, where additional information and resources can be found.